යොදවා තිබෙනවා.
Today we are talking to Dr. Sanjay Senanayake, joining us all the way from Canberra, Australia, about the present COVID-19 situation of the country here in Sri Lanka. Doctor, let's get to it straight away. The situation here in Sri Lanka, 2 people have passed away. The infected cases are on the rise. You being a virologist and a specialist on infectious diseases, what is your particular viewpoint of the spread of the virus as of now since the outbreak?
Yes, hi. So Sri Lanka now has 3 recognized clusters in Colombo, Gampaha, Kalutura. And there are a number of people and homes under quarantine. And of course, there's also curfew. So I think Sri Lanka is at a very critical point of the outbreak. And they should go on 2 principles in terms of testing lots of appropriate people and trying to identify those who have the infection so you can isolate them and prevent them from infecting other people. And also, once you've identified someone with infection, finding close contacts who may have been infected but are still not sick and quarantining them. So those things seem to be happening now in Sri Lanka. But of course, Sri Lanka has quite a large population for a small area. So there's quite a bit of population density. So it is very important that these social distancing measures are observed.
Doctor, speaking of being tested positive or negative of the virus, now there are many methods across the country, newly introduced methods. There's a 5-minute method. What do you think, are those methods introduced by various countries, various parts of the world accurate? Or what do you think is, what do you reckon the accurate method is to test for the coronavirus?
So there are a few ways to test for it. The initial way, and the one that at the moment seems the most reliable, is taking the swab of the nasopharynx, so the nasopharyngeal swab, and testing for a genetic component or part of the virus, so doing a PCR test. The original test, though, will take in a laboratory about 5 to 6 hours to process. Since then, there have been the development of a number of faster tests, some also involving the nose swab or nasopharyngeal swab, which but is much quicker, and some which test the blood, so a pinprick to test the blood and see if we've made antibodies to the virus. Now, the only thing with these newer tests as well, because they've been developed very quickly and certainly have undergone some testing, we also have to be wary about how accurate they might be. So certainly they might have to be tested in conjunction with the original test, the nasopharyngeal swab that takes 5 to 6 hours to do. And of course, even the original test, the nasopharyngeal swab that takes 5 or 6 hours to do, that was the first test. So we have nothing to compare that to. And we're assuming that is a very accurate test. But we're still not sure about that. So there, in other words, what I'm saying is we have to keep our minds open to the fact that some of these tests may be very good in some circumstances, but not so accurate in others.
Globally, many countries, the World Health Organization also have advised the people across the globe that the coming 2 to 3 weeks is going to be very dangerous, that we have to be cautious, we have to be vigilant in the coming 2 to 3 days. We saw US President Donald Trump predicting loss of life in his country. Against that backdrop, what should the Sri Lankan government, what are the measures that the Sri Lankan government should take, and especially what the people should do?
I think it is very reasonable to have closed the borders for international travel coming into Sri Lanka. Certainly here in Australia, the vast majority of cases that we've seen, 4,000 cases, have been associated with travel. There's very little community transmission. So I think if you can stop that in Sri Lanka and just focus on any community transmission and clamping down on that, there is a good chance of success. But the Director General of the WHO also has a mantra, which is test, test, test. So I think it's really important to make sure that Sri Lanka has a lot of test kits and they are able to test as they want. So the US, which is really struggling, is only testing about doing 313 tests per million people, whereas countries like South Korea, which have done quite well in controlling the outbreak, are doing 6,000 tests per million people. And in Australia, we've done a lot of tests close to the South Korea mark. So maintaining social distancing, keeping the borders closed at the moment, and test, test, test will be very important. And it's really important for the public to cooperate with the government in this.
Doctor, with the stats and figures so far as of now globally, is it a favorable or an unfavorable situation that is prevailing in the world?
That's very hard to say because some parts of the world are better than others. So here in Australia, for instance, we're at the moment seeing a small downturn in the number of cases. Now, it may be too early to say if that's going to be sustained, but we're hoping it will be in the context of a lot of testing and the social isolation measures that we've taken. But the United States, for example, seems to be in dire straits. They've almost registered 200,000 cases, and places like New York are struggling to identify sick people and treat sick people. So it is varying in different parts of the world. So I think we will find that over the next few weeks, some countries will improve, others might get worse. So it will be a heterogeneous mix of patterns that we'll see.
Doctor, we received the news, we saw the news that a large supply of medicine is on the way to Australia as well, as a way to curb the virus. Yesterday, Japan donated 5,000 pills of Avigan to Sri Lanka now, but there are no talks of a permanent cure for this virus, a vaccine, nothing as of yet. What are your thoughts about that?
Yeah, so what I would really love to see is a vaccine that that you and I can have, and we can take our families to the doctors to have, but that's looking like it'll be about 12 months away. It's not that the vaccines aren't physically there, but they have to undergo testing to see if they're safe and if they actually work. But I think that's the most likely factor that's going to curb this outbreak. In terms of medicines to treat people who are sick with the virus, there are no approved medicines that work for this virus. There are speculative medicines, such as a malaria medicine, chloroquine, and its relation hydroxychloroquine, which in the laboratory setting have some antiviral effects, and in a study or two may have had some impacts, and they are being used in clinical trials, certainly here in Australia and in other parts of the world. There is a drug developed for Ebola called remdesivir, for which there are trials going on in at least China and America, which again seems to be showing some promise, but it's hard to know when that will be widely available.
Thank you very much, Doctor. That was Dr. Sanjay Senanayake joining us all the way from Canberra, Australia. And the World Health Organization has praised Sri Lanka for its efforts taken to eradicate COVID-19. That are the efforts of you and I have taken as a nation. So therefore, stay home, stay